Hello everybody, this is Žiga from 2100 News. We're the leading news hub for the crypto markets. Today I'm talking with Abdullah Albeyatti from the Medicalchain company. They are developing blockchain for electronic medical records. So how are you doing today, Abdullah?
I'm fine, thank you, Žiga. How are you doing?
Yeah, pretty well, pretty well. Well, first I would like to ask you if you could just describe your project briefly. What is it about?
Sure. So Medicalchain is a platform for the storage and utilization of electronic health records using blockchain technology. Okay. So this platform is going to empower patients to let them have their medical records with them, meaning whenever they talk to a doctor in a family practice or a hospital or private hospital or even somewhere else in the country, they are always carrying and have access to their medical records with them. And this is the first stage of Medicalchain, and then we are building some platforms on top of this, such as our telemedicine application, as well as our health market dataplace application.
Very well, very well. So you have already started with the ICO, is that right? How is that going? Everybody expected you to finish in minutes?
Everybody was as enthusiastic as we have been about the ICO. So the ICO started today at 10 a.m. UTC time. Yeah. We had a very difficult decision to make whether we were going to let everybody send us Ethereum or whether we should do the KYC first. Now, we had over 130,000 applications come to the Medicalchain system. From that 135,000, 45,000 applied within the first 2 minutes when we opened the ICO.
Congratulations. Yeah.
And from that 45,000, we only need probably about 2,000 to 3,000 to close the ICO. So we could have closed it in less than a minute. But what is taking long, and what has now been 5 hours since we opened the ICO, is the KYC process, which we are very stringent about and we are very particular about. So we're not asking anybody to send us Ethereum until we have definitely checked their documents and we're happy with it, and then we're inviting them. So I think a lot of people were expecting us to finish in minutes. We could have, but it will take some time until we have done the KYC for the necessary amount of people.
Yeah, also, I have information that you rented out 200 servers to secure from crashing, to secure the project from crashing.
Exactly. So again, as a company, Medicalchain, we want to be responsible for the demand that we have created. And as you can see by the size of our Telegram group, over 50,000 people are on this Telegram group. If we didn't rent these servers and take this KYC responsibility and the process on ourselves, this would have all gone onto the Ethereum network instead. And then we would have been blamed for crashing the Ethereum network instead, having 45,000 people send Ethereum in the first 2 minutes to us. So it's either the whole Ethereum network or it's just the Medicalchain team. And the team right now are working very hard in the office next door to me, and I've taken some time out to speak to yourselves as well.
Yeah, thank you very much for that. It's already showing a lot of signs for the success, so congratulations for that as well. So
thank you very much.
If we move along, do you anticipate any problems with launching your project? Maybe what's on your radar to watch out for?
No, I think so far our project has gone according to time, or even better than we were expected. So there's always two elements to a project. There is the business side, the ICO and being listed on exchanges. Yeah. And then there's the actual platform or what you're trying to develop and share with people. So from the business aspect, everything has gone according to time. As I say, hopefully in the next few hours, we would have finished the whole ICO process and finished all the KYCs and received all the Ethereum. We are already being listed on several exchanges in the coming days, which we've announced in our Telegram group as well. And from the actual project Medicalchain platform, we're soon to release the GitHub, and we also have a closed beta user interface that we want people to see as well. And this will be coming in the next few weeks, if not sooner. And then we can demonstrate to people the pilots we are running as well. And as I say, we are on track for everything, thankfully.
Very good, very good. Even if you have a lot of traffic, you're still on track, so that's a very good sign.
Yes, thankfully. Everybody's working very hard to stay on top of everything.
Yeah, that's great. Could we maybe talk about your token? How does it function within the platform? Why is it needed?
Sure. So our token is called the Med token, and the principle behind the Med token is that this is going to be the currency that people exchange in our economy of the medical chain platform. So if I take you through it briefly,
Yes,
if a patient wants their records onto the medical chain platform, it's completely for free.
That's great.
It's completely for free. If the patient then wants to talk to a doctor, similar how we're doing this Skype call, somebody does a telemedicine application call with a doctor, they can give the doctor access to their records. So the doctor, as well as doing the video call, can see all the records at the same time. Yes. The patient will pay the doctor in Med tokens.
Ah, that's great, yeah.
Now, it's not just the patient paying. The patient also receives Med tokens. And where the patient receives Med tokens is in our health market data place application. So pharmaceutical and research companies want to interact with patients' records. And the medical chain platform allows patients to hold on to their records. So rather than the pharmaceutical and research companies talking to hospitals, they'll come directly to the patient. And they will pay the patient in Med tokens for the patient to share their records with them for the purposes of research, or even for the purposes of health insurance, for example.
Yeah, that's a great idea. It sounds like it's going to revolutionize the whole medical space.
I hope so. I mean, it's something that the medical space has needed for a very long time, not just in the UK, but worldwide. And I think it's anybody who talks to their doctor will know the common problems of, why can't you see my blood test? I only had it done last week in a clinic down the road. And the doctor will tell you, I'm sorry, it's not on my system. I can't see it. And, you know, this is madness with what we have, the technology today, how things are being used, and especially with this revolution, which is blockchain technology, which the financial sector has benefited from, we need to benefit from as well. And we're going to do that with the medical chain platform, with Med tokens. Our symbol for Med tokens is M for mother, T for tango, N for November, MTN. And I hope that obviously people will be interacting with this for the sake of the exchanges. But I would encourage them to hold on to this, as this is around the corner that they can use these tokens properly and give it utility and function.
Yeah. Okay. Do you maybe see any competition in the medical space with what you're trying to do? Is there any competition?
Yes. So there's very good companies out there as well doing things similar to ourselves. So there's a very good company called Mediblock, which is a South Korean company doing similar things to us with using blockchain technology for health records. There are a few differences between us, which have been published online, that people can see the differences between us. Yeah. And there's also an American-based company called Patientory, which have actually been around for a long time now, who are still, I believe, working hard to actually produce something at the moment. I think we have demonstrated we are the largest of these blockchain health companies. As I say again, our community is very large, our reach is very large, our roadshow that covered all of the major cities of the world. So people have met me face to face, they've seen my presentation, similar to one I gave in New York to the Financial Times Digital Health Conference, or several I've given in Tokyo, Japan, or others I've given in Italy or in France. So we really have covered the globe with our medical chain platform and ideology. And I think once we have our pilots up and running as well, we'll again demonstrate how we are leading this marketplace.
That's great. So maybe where are you planning to launch first? In which countries?
So I mean, it depends really. It depends on the traction that we've had from countries. So for the low-hanging fruit or the ease of language, English-speaking countries. So these are going to be the UK, the US, Australia, for example. In terms of traction, the Far East has actually been a very big supporter of medical chain, being South Korea and Japan as well. So we would love to launch in these countries as soon as possible. Yeah. But I think logistically, we have to make sure we are successful in the UK and the US first of all. And then once we know our platform is fully functioning and has not faced difficulty when it's been put under strain, then we can always translate our platform into the other languages and go to the Far East, where there's a great need and a great demand for it. It's
going to have to be translated, and the medical care is very important. So,
of course.
You also,
but at the end of the day, we're all humans.
Yeah, that's it.
Our X-rays are the same, our scans are the same, our blood tests are the same. So a few of it is language barriers, but from a doctor's perspective, when I see you, you're still a human.
That's it. Yeah, I agree. You also, I wanted to mention that before. You also have a product, Medicalchain bracelet.
Yes.
So, what actually, if you can just describe it for everybody to know, what is the bracelet going to be? When is it going to come out?
Excellent. So, the best way to describe it is to describe a normal scenario and then describe an abnormal scenario and why you would need the bracelet. So, a normal scenario, I'm your doctor, you're my patient, you give me access to your records, and we've started the consultation. Now, an abnormal scenario is you're a patient, you've had a car accident, and you're unconscious in the hospital. If you are not conscious, you are not able to give me access to your records. With our Medicalchain bracelet, what we hope with this NFC technology, which we are going to put into other smart devices such as smartwatches and smartphones, the doctors in the hospital will be able to unlock your records using this device. Now, in a normal scenario, when you say to the doctor, I'm happy for you to see my records, we can fully unlock your records. In an emergency scenario, you have already predetermined what you are happy to be shared, what information you're happy to be shared in an emergency. So in an emergency, I'm happy for you to know my name, what my allergies are, what my blood type is, and please phone my wife if I'm in emergency. You don't need to have access to my skin problems, my mental health problems, or anything else. I've had a car accident. That's the only important information. And the way to unlock that information is the doctor would come and scan your bracelet. Now, it would take 2 doctors to scan your bracelet in a very short space of time in order to unlock that information. So anybody that has the fear that somebody in the street can walk by and unlock your bracelet, this is not the case. It has to be 2 because at the end of the day, you are breaching somebody's privacy. And privacy is something that we hold very important to us in Medicalchain. Your health records need to be completely protected and only accessed by the correct people. If you're in an emergency situation and you cannot verbalize or show that you are happy for your records to be accessed, it needs 2 doctors to agree that in this emergency life-saving scenario, they both agree they should overrule the bracelet and unlock your health records to have access to it.
So as you said, so the doctors are going to be registered in some database, or how are you planning to do that?
So there will be 2 populations, if you will, that are being registered on the Medicalchain.
Yeah, exactly. The users and the doctors.
Exactly. Okay. So this is why we use a system called Hyperledger, and Hyperledger Fabric allows this granularity access. So the patient can see the records in a read-only format, and the doctors can see and add to the records as well, read and write. In order to be a doctor on the Medicalchain platform, you have to go through very strict criteria. So you have to be licensed with your medical body in your country. You have to have appropriate insurance in order to use our platform. You have to prove that your training is up to date and not something you did years and years ago. And you have to prove you don't have any outstanding investigations against you or somebody has made a complaint against you. After you have proved all of these characteristics, you'll be welcomed onto the Medicalchain platform in order to interact with other patients' records with the patient's permission.
So if I understand correctly, it sounds very interesting and very good. It's going to help a lot of people. If I understand right, so even at getting the second opinion from a doctor, let's say, and I'm from Slovenia and I want to have a second opinion from a doctor from, I don't know, England, USA, whatever, I can get the second opinion for exchange for Met tokens.
Exactly, because you have access to your health records. So you can have a video call with any doctor in our database that we have approved, and you can share your records with that doctor. Now, after you've finished your consultation, you can revoke that access. That doctor doesn't have access to your records forever. It's only the time period, the time-limited period that you have given them access to. And the idea is, as you're saying, if you are seeking a second opinion or a specialist opinion, you can share your most up-to-date records, which will include your scans, blood test results, other doctors' opinions, so that you can have a much better consultation experience.
That's great. Sounds very good, Abdullah. Sounds very good. Do you maybe have any partnerships within the industry already, or?
Yes, so our partnerships have been listed on our website as well.
Okay.
So these are to do with the Hyperledger Fabric, to do with Civic as well. In the UK, our first platform was called dischargesummary.co.uk, and this is something that we've established in a few of the NHS, National Health Service hospitals in the United Kingdom, which are the government hospitals here. We have some links with hospitals in America, in Poland, in Turkey, and these are the ones that we're working very hard on. In terms of our pilot, hopefully will have 2 pilots in the UK in family practices, so where we can demonstrate that our technology works and the benefits to not just the patients, but also to the health care staff, the clinicians who are using our system as well.
So when you're planning to launch Medicalchain token on new country, it's safe to say that you are actually looking at hospitals where you could get doctors, or that's probably the best partnership for you. It's probably hospitals, right?
Yes, I mean every qualified doctor has the right to see patients privately or in their own time or their free time, and this can be hospital doctors or family doctors as well. In terms of the interactions, as I said, as long as they are on our system and they've passed our stringent criteria, then they're more than welcome to interact on our platform with any patient anywhere in the world.
Can you maybe just briefly describe how does a doctor get registered, and how do you know that this doctor is legit?
So if I take the UK, for example,
okay.
So the first step to prove that you're a doctor, you have to be licensed with the body of doctors called the General Medical Council, GMC. If you go on the GMC right now, you will find me as a doctor, registered as a doctor on the system. It will show you where I graduated from, and there'll be other information on other websites which will show that I have the appropriate insurance, the appropriate training, and that I don't have any outstanding investigations against me either. So this is us as a company, Medicalchain. We need to do our due diligence on all the doctors that want to join us and make sure that they have the appropriate criteria in order to be onboarded onto the system, and in order to give them the read and write permission access to the records.
Okay. And when the doctor establishes his profile on the Medicalchain website, can he offer his services? I mean, what is he doing? What is he specialized at?
So this is something when you go on the Medicalchain platform, you're going to see a criteria of doctors that you can select from. So, for example, you have a shoulder problem. You want to talk to an orthopedic doctor, which is a bone specialist doctor, and you want to talk to a shoulder specialist within that division as well. So when you're searching through names, you could say, show me UK doctors, show me UK orthopedic doctors, show me UK orthopedic shoulder specialist doctors. And it will show you the doctors which are available for you to have that consultation with.
Okay, great. So your project, where is it right now, and how is it progressing for now? You just launched the ICO, which obviously has a huge demand. But what about from the blockchain side of it?
So from the blockchain side of it, our engineers and developers have nearly finished the APIs, and we're going to be releasing this information on GitHub, so people can see the elements which we're happy to share will be shared on GitHub. And in terms of the user interface, we're hoping to show people the application and what it looks like at this stage. And then we're hoping to run our pilots in the coming months. And then by the time we get to July 2018, we'll be able to have demonstrated a system which is up and running and successful.
So that is the next step for the Medicalchain.
As soon as this ICO finishes today, that's where we're going to switch our focus.
That's very good, Abdullah. And maybe just if we finish with a business side of it, where maybe investors are very interested about that information, what exchanges is the token going to be listed on? Do you maybe have any?
Yes, and some have been announced already on our Telegram, because I know all the ones that we are going to be on.
Okay.
And I just want to make sure I don't tell you the other ones.
Yeah, no problem.
haven't released them already. So if you bear with me one moment, I can tell you that we have very big ones, which are coming soon. The exchanges will be released Sunday, Monday time for people to see as well. And in terms of the other exchanges, which is already public knowledge, I'm not able to tell you yet, because this is still something which we haven't fully released. But it's all on our Telegram group, and I'm hoping that other exchanges will also be advertised in the coming days. and I'll happily share that information with you.
So to follow you up, it's the best to just use the Telegram channel and what did you say, GitHub? Was it GitHub?
Yes, so GitHub is where you see all of our code for our platform, and the Telegram group is the best place to get all the up-to-date information about Medicalchain and the exchanges as well. I know 5 exchanges in my head, but I don't want to say them in case we haven't announced them yet. I think we've only announced 2 off the top of my mind now, which I think was... and no, I don't want to take a chance in case I say the wrong one to you. But it's coming. In the coming days, you will know all of them. They will all be advertised.
That's perfect, Abdullah. I'm going to finish our interview right there. I wish you a lot of success with Medicalchain. Thank you very much.
Thank you very much. Thank you for your time.
Thank you.